The definition of a concussion is a transient change in neurological status related to some sort of traumatic injury that occurs to the body that presents through brain changes. Things such as headaches, neck pain, dizziness, not feeling right, emotionalness, it all can relate to having a concussion. You can have symptoms from a concussion even by body blows or some sort of force applied through the body. It does not just have to be to the head. We have seen symptoms out to 24 hours even after having some sort of impact on the body. Now, the big traumatic injuries where you have a loss of consciousness is pretty easy to understand, but these subtle things such as emotionalness, feeling tired, feeling out of it can present later on, or some people won't notice it. If you develop symptoms after some sort of injury that you feel may be a concussion, you should be evaluated by a medical professional who's trained in evaluating concussions, whether that be a physician, a APP, such as a nurse practitioner or a physician assistant, but also athletic trainers can evaluate people for concussions and diagnose them. For someone who's under 18 years old, symptoms can last up to 4 weeks. In someone who's older than 18 years old, again, it can be up to 2 weeks that you're going to have symptoms. Symptoms can last very long or very short, and everybody's different, and that's why being evaluated by a physician or some sort of medical professional is very important for a concussion. Once you are diagnosed with a concussion, you are then placed into what we call a protocol. And that includes having rest, whether both cognitive and physical rest, until symptoms subside. During that time, your physician may want you to actually exercise a little bit if symptoms aren't made worse. We try to get you back to school or some sort of work-related activity as soon as your symptoms allow it. But then we're ultimately not going to progress you back into any sports-related activity until you actually are asymptomatic, and then go through a 5-day progression. It's always important to make sure you watch for any return of symptoms once you come back to play. Now, there's no literature out there that tells us specifically if you are more at risk or less at risk, but ultimately making sure you're continuing to monitor for symptoms moving forward is always important.